Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about sports injuries and things related to sports, and joining me is Dr. Steve Huang. He is assistant professor at the University of Oklahoma School of Community Medicine in sports medicine. Welcome to the program, Doctor.
Thank you. Thank you. Nice to meet you.
Now we're going to talk about sports injuries and common sports injuries and sort of treatments, as well as some other things related to sports. Before I begin, though, I want to ask you, for people that are wondering, how do you become a sports medicine physician? Because they may not really understand what that means.
Great, great. That's a great question. Actually, there's several different routes to become a sports medicine physician, and I am a primary care sports medicine physician, okay. So that means that I do not do surgery. The way I took to get there was your 4-year medical school, mm-hmm. and then 3 years of family medicine residency, and we have one here in Tulsa at OU, okay. And then 1 extra year of what we call fellowship in sports medicine. And for primary care, that can be either through family medicine, internal medicine, emergency medicine, or pediatrics. Okay. And then there is another branch of sports medicine, which is a fellowship after orthopedics, okay. And that's a surgical program. Okay, so being a primary care sports medicine physician, people may understand, coming to you, you would then refer on to the sports medicine physician that does surgery if surgery is needed? Is that how that Correct.
Happens?
Yeah, you know, when you think about people who are athletes, mm-hmm. and teams of athletes, they all need a doctor just like the rest of us do. So we can take care of pretty much any medical problem that they have, and if they do need surgery, then we will have them see a surgical sports medicine doctor.
Okay. Well, let's jump and look at, sort of break this up by sports in terms of sort of common injuries and some other issues.
Okay.
Since my son played football at the collegiate level, I want to start with football, okay?
Sure.
Then let's start with football. I do want to ask you about the jersey finger type
okay.
of injury, because he did have that. And I must say it was misdiagnosed where he goes to school as just a stretched ligament kind of thing.
Okay.
But when he came back to Tulsa, we find out it was not. It was the jersey finger. So tell me about jersey finger.
Okay. A jersey finger, and it's named jersey finger because it typically happens when someone grabs a hold of a jersey, mm-hmm. and the player whose jersey it is continues to run. And what happens is there's a rupture of a tendon in the finger. And in this portion of, let's say it's the middle finger, okay. You have a tendon that runs along what's called the volar side of the hand, and it inserts on the what we call the distal phalanx. Okay? And when you grab onto a jersey and the person continues to run, you are flexing that part of your digit through force. And if the force is greater than the holding force of that tendon, it will rupture, and you will no longer have that attached to that distal portion of your finger.
Okay, now when that happens, what kind of symptoms is the person going to get? Because he was having very difficult time even moving. His was the ring finger.
Sure.
Even moving his hand, and they taped it all up and did all that, and he kept playing. But
okay.
What symptoms should the person playing ball know to look for?
Okay. For this particular injury, of course, they're going to have pain. Anytime that you break something or rupture something, you're going to have pain. Mm-hmm. So that's number one. Additionally, you'll probably have swelling, maybe some bruising, and you will also have the inability to flex that portion, that last portion mm-hmm. of that finger. So if you were, after the game, you were moving your fingers around, you would notice that it would not move as the rest of your fingers do. It would probably be straight instead of flexing with the rest of the fingers.
Okay. Now, with this pain, is it going to be excruciating? Is it going to be continuous? Because he ended up playing the whole season with
okay.
it just being taped, and
yeah.
he did complain of it being uncomfortable,
yeah.
and was doing the ibuprofen, which was really not helping very
sure.
much. But does
sure.
the pain tend to really stay intense, and the person just pretends it's not there because they want to play?
Yeah. It's hard for me to say specifically because I've never had one before. Mm-hmm. But my guess is that you'd have extreme pain at the beginning. Okay. And if it's in the middle of a game, you may not let it bother you as much mm-hmm. to come out of the game. But I think it would tend to bother you probably throughout a season. I don't know specifically about your son, there's probably going to be at least a certain amount of pain that he's going to have continuously.
Right, and that is something that happened that the player should not ignore. Now, when we look at treatment, what is the treatment? I mean, if this happens, how quickly should you get treatment?
Well, the first thing you want to do is properly diagnose it. So seeing a medical professional who is trained in these types of injuries is first and foremost. If you were to diagnose one of these, you'd want to have early surgery. The reason is because as time goes on, the tendon that's been ruptured can retract, meaning pull back into the hand or into the finger. And as it shortens, your opportunity for a good outcome with surgery would be less and less. So you don't want to wait too long on that.
Right, and I would second that because that's what happened with him. They waited too long. They kept saying it was just a stretched ligament.
Okay.
And it was 7 weeks out, which is getting really past the point of what is really recommended.
Sure.
So he still struggles with that even now. In terms of prevention, what should we do to prevent that? Because it can be a common injury.
Sure. Preventing finger injuries is very difficult because you can never anticipate exactly what's going to happen in the middle of a game. There's no specific prevention for this type of injury, so it's not that every finger should be taped a certain way. It's just a matter of proper diagnosis and getting proper treatment when the injury does come. Okay,
and my suggestion would be to wear a steel glove, but of course that's not going to work.
In retrospect, hindsight is 20/20.
Yeah, you can't do that and actually play ball. In terms of looking at football as far as preparation with sports drinks and things like that, are there certain sports drinks that are better for kids or young adults to use, like the Gatorades or those types of things, or is water the better thing?
It really depends on the length of your exercise day. So generally, it's recommended water for short bursts of activity.
Okay.
And that's the easiest thing to do. It's easily palatable and it's very accessible. If you are going to exercise longer than an hour, especially in the summer as we sweat more and more, then you're going to want to replenish not only your water in your body, but your electrolytes as well. In which case, something that has some sodium and other electrolytes and even carbohydrates is really recommended. Gatorade is a great choice, and there's others also on the market. Generally, these drinks have about a 6% carbohydrate solution, and they found that this is the most easily digestible and well tolerated. So anyone who's going to exercise, more than an hour, you really need to take in a good amount of sodium, being a Gatorade or some other kind of drink that way. And you can also mix it, as in, you do 50% of Gatorade, and then you could do 50% of water. So you could alternate your drinks.
Those two, okay.
And I'm a basketball player. I like to play basketball, and that's what I do. I take a water with me and a Gatorade, and then I switch back and forth.
Okay. Okay. And the vitamin waters, are those just as good as water?
Vitamin waters, they will replenish vitamins, but vitamins are not really what you need in the middle of your exercise program. What you want to do is you want to replenish the things that you're losing there on the spot, which would be your sodium, your potassium, and then the fluids themselves.
Okay, well, we're going to take a really quick break, doctor, and come back and talk about a few more injuries.
Great.
Okay, please stay with us. We'll be right back.